Hey, good morning, Decatur, and thank you for joining us on this rainy Monday. Goodness, it's been a rainy weekend for sure. We're pleased to have with us this morning Decatur Morgan Hospital President Kelli Powers. Kelli, thank you for joining us again.
Thank you.
And then we have Alabama Department of Public Health Assistant Administrator from the Northern District, Michael Glenn. Michael, thank you for joining us.
Thank you. Good morning.
Yes, sir. So here's just a COVID update. As of today, we have right at 19,400 total cases in Morgan County. That's an increase of 618 cases, or about 3.3% this week, as reported by the Alabama Department of Public Health. The moving 7-day percentage positive rate is 19.7%. That's approximately 44,300 positives, individuals who have completed their vaccine series in Morgan County. So let's go back and read that again. That's 44,300 that have completed their vaccine series in Morgan County. Mm-hmm. So we're thankful for those that are receiving the vaccine. And so with that, Kelli, if we could get an update from the hospital.
Yes, sir. As of this morning, we have 71 inpatients, which is down a little. We have discharged some, but we've also had some deaths. One presumptive patient. Of that, 15 are in ICU and all 15 are ventilated. The ER, we're holding actually 3 at the Decatur ER. One of those is for a step-down unit, 2 ICU patients in the ER, and we're holding 1 medical patient at Parkway. Again, more deaths, from it. Not quite as many as we had the weekend before, but still 15 in the ICU and all 15 ventilated.
Okay. Thank you, Kelli. And Michael?
Well, thankful that we're starting to see some signs of positivity. I'd like to bring some good news. As you mentioned at the beginning, Morgan's 7-day average is 19.7, so that's down about a little over 2%. Still very high, a lot of community transmission going on, but we're headed in the right direction, so that's positive news. The state positivity rate is down to 16.4%, so that's a little over 3% positivity rate over the last 7 days, and so that's an encouraging sign as well. The hospitalizations, yesterday was the first time statewide that we've been under 2,000 people hospitalized with COVID since August the 8th, and so that's a positive sign. Unfortunately, there is still a lot of deaths going on, as Kelli mentioned, just not only locally but statewide. Most days we're seeing double-digit deaths, and so that's still concerning. And the deaths are one of the last things that we start seeing improvements in, because those people have been sick, they're hospitalized, and so those are one of the last things that we see. Last week, the testing at our health departments were down. The demand for testing was down some. So again, the positivity rate being down, the request for being tested seems to be lower. And so all of those signs are pointing toward maybe we're heading in the right direction. Just wanted to remind everybody that the new testing center at the Police and Fire Training Center is still up and running. To pre-register, that number is 205-927-3438. You do not have to pre-register. Just helps your process go a little bit smoother if you want to. The first couple of days last week, they tested a little over 94 people those first 2 days. And so that's available to the community if they need that as well. As we said, continues to be a lot of deaths occurring right now. One of the sad things that occurred last year, we just found out as the numbers are continuing to be finalized. 2020 was the first year since we've been keeping records that we had more deaths than we had births last year. By a significant number, a little over 7,000 more deaths than we had births last year. So again, a lot of deaths this year, so we may see that for 2 years in a row. And so that's a sad thing when this is a vaccine preventable. And so I got a little bit of information together just to kind of to stress the importance of vaccinations. We've had a total of 13,210 people to die of COVID since this began. Since April the 1st, when vaccines were readily available to the community, there have been only 195 breakthrough deaths. And so what that means is once somebody is completely vaccinated, since April the 1st, there's only been 195 people that have passed away. It's interesting if you dig down into the numbers even a little bit further than that. 116 of those 195 were 75 or older, and so in the older population. And then for those 65 and older, 159 of the 195 were 65 or older. And so we've only had 6 people to pass away that are fully vaccinated that are under 50 years old. And so vaccinations is the greatest measure to prevent serious illness and death. And so we would encourage people to continue to go out and get your vaccine. Vaccines are readily available. You can get at the hospitals, you can get at the health departments, your pharmacies, and so we would continue to ask you, if you're not vaccinated and you're hesitant for some reason, please talk to your healthcare provider or somebody that's gotten the vaccine and get reliable information. Last thing I want to talk about today, we're starting at some of the health departments to get calls for adults wanting religious exemptions from COVID vaccines. The health department does not do that. And so please don't call the health department seeking religious exemptions for adults. The health department provides religious exemptions for school-aged children for the vaccines that are mandated in the state of Alabama for school. COVID is not one of those vaccines, so you don't need a religious exemption for COVID vaccine. And so just information for the public, we're starting to see more adults to reach out to the health department wanting a religious exemptions, and we don't do that for adults. And so I've just closed today by saying, please protect yourself. This is a vaccine preventable disease, and all of these people that are dying that are unvaccinated is just heartbreaking when we have the tools available that we don't have to go through this. And so for your sake, for your family's sake, and for those that care for you, please get vaccinated.
Thank you, Michael.
I want to add.
Yes,
Can
ma'am.
I add to that? Of the 15 I have in ICU, none of those are vaccinated. Of the 71, only 4. So 4 of my total 71 patients are vaccinated. If that tells you anything. Also, Michael, we're starting to do flu shots. I got mine last Friday. So remember, flu again, and flu and COVID together is a deadly combination from what we saw last fall. The other thing I wanted to just mention, do not delay your care because of COVID. This last week I saw 2 patients that, just heartbreaking, that they went too long without getting a mammogram. One patient went too long, didn't get some of their lab work checked, so they have cancer. Could have caught it earlier, 2 years ago. So make sure you are going to your physicians and getting your routine care done. That's lab work, mammogram, PSA checked, all those things. We provide a very safe environment for patients to come in and have any ancillary testing. We are 100% masked. That's why we make the community wear their mask when they come to visit. We sanitize, so everything, we have very good precautions in place to make sure you're not going to catch COVID-19 while being in any of our facilities. But please, that's on my heart today. Please, get checked and make sure you're getting your labs and all your preventive care done, just to keep you from dying from something else.
I had some testing about 6 months ago, post-COVID, for me, and going into Decatur, Morgan, and to Huntsville, it seemed that most everyone was redundant, so they had 2 masks on.
Yes, sir, we do.
Yeah. I guess they were topped off with an N95 at the same time.
They are, yes, sir. We've required all of our staff, since we saw this last surge, to wear an N95 and a surgical mask if you're in the areas where there's COVID positive patients, mainly to protect our staff.
Right.
So as you know, we're still down a lot of nurses.
Yeah.
So I want to make sure that we take care of all of our staff and that they don't get it.
It just makes me feel good as a patient to know that the things that you're talking about, that's exactly what I witnessed.
Good, thank you.
And then as I was coming in today, on the news, there was an announcement, Pfizer has announced a vaccine for 5 through 11-year-olds.
Yes.
So I guess that has to go through the steps before they start administering that, and to get that out to folks like y'all to be able to give. So what's is there any factual data on how easy it is to transmit the Delta variant? As in, how long to be around someone?
I don't think the guidance has changed as far as those close contacts, the 6'15" rule, the 6 feet, 15 minutes or greater. We know that Delta is highly more contagious than some of the other variants, and so it probably doesn't take as long, but I don't know that there's any hard and fast data on that right now.
Okay, so my point, and this is no secret, it was all over the news. Last week, right sitting where you are, was really where, Councilman Pepper was sitting. And of course, Councilman Pepper was diagnosed COVID positive. And so next to him was Councilman McMasters. And then standing at the podium for a lengthy period of time, longer than 15 minutes, was our CFO. And so with our protocols, just out of abundance of caution, Those folks got to spend some time at home, but they tested negative, thankfully,
Good.
over the weekend, and they're back here today. And we continue to keep Councilman Pepper in our prayers.
Yeah,
So
yes,
just
we
kind
do.
of how easy that is to affect
It
so
is.
many is the point that I'm trying to make. So with us today, we have our media partners. We have Lauren Hartson with Channel 19, WHNT. Lauren, any questions?
Hey, Lauren, putting you on speaker.
All right, perfect. Hey guys, good morning. Kelly, I know you mentioned that the hospital is now offering flu shots for people. Could you talk a little bit about why that's important to go ahead and get the flu shot, along with the COVID vaccine, of course?
Well, I think, and we're offering for our employees, right now. We're not going out in the community yet, just because we're so focused on COVID-19, but we will be. But there are other places you can get the flu shot. That's why I wanted to put it out there. It's very important because some of my ER physicians tell me that last fall when we had, we don't have as much flu because of social distancing and masking. Flu has not been at the level that we've seen in the past years prior to the pandemic. But together, flu and COVID, they call it a definite deadly combination because you're taking two viruses and putting them together. It's really hard for a lot of people to recover from that. So just what we saw in the fall last year.
Okay, thank you. And then I know last week it came out that it's now recommended for the COVID booster to only be taken by those who are older and those who are immunocompromised. So I was wondering if the hospital is still offering the booster to anyone who requests one.
We are offering the immunocompromised shot, and I hope that information comes out this week and gets approved by the CDC and FDA for anybody over 65, anybody immunocompromised, or anybody who works in an environment where, like healthcare workers, where they are subject to being around COVID positive patients all the time. So we hope that gets approved this week so we can continue giving vaccines just to make sure. A lot of the cases that we're seeing at the hospital, as the mayor mentioned, on breakthrough cases are some of our employees who were vaccinated late December, early January, and then I've had two in particular who test positive for COVID. So they were vaccinated, but they test positive. So we are seeing that, over time, the amount of antibodies you have does decrease.
Okay, thank you. And then this is for really anyone who wants to talk on it. We've been talking all morning about how it seems like numbers are starting to go down a little bit. So do y'all think this will continue, or do you think we're in an odd period right now and we're just kind of waiting and watching to see if it continues to go down?
Well, I'm going to be optimistic and say we're hopeful that this is a trend that will continue on. But the way to optimize that is continue to be vaccinated, continue to social distance, and wear your mask if you're in groups. Because again, 56% of Morgan County's population right now still has not been fully vaccinated. And so when you're in large crowds, over half of those people that you're around more than likely are not vaccinated. And so we can end this and continue the trend if we'll just do the right things.
All right. Thank y'all so much.
Thank you, Lauren. And then we have Dion Host with Channel 48, WAFF. Dion, any questions? Okay, very good. So that said, we want you to stay safe this week, especially today as we have so much water standing on our roadways. Be cautious as you drive. If you want to get vaccinated, you can visit the health department, the Morgan County Vaccine Clinic, or go to vaccinefinder.org to locate a vaccine provider. Until next time, be safe, and be kind. Thank you.